Welcome. Thank you for joining us for the Oley Foundation webinar, Complications of Home Parenteral Nutrition, What to Do and How to Minimize. My name is Andrea Guidi. I am the Executive Assistant for the Oley Foundation. Most of you are probably familiar with the Oley Foundation, but just in case this is your first experience, I'd like to briefly introduce the organization. The Oley Foundation strives to enrich the lives of those living with home nutrition support, both intravenous nutrition, sometimes called HPN or TPN, and tube feeding. We do this through education, outreach, and networking. The Oley Foundation was founded in 1983 by Dr. Lynn Howard and her patient, Clarence Oley Oldenburg. Today, we serve approximately 19,000 members. All of our programs are free of charge for patients and their families. First, a few housekeeping details. You should see a toolbar on the right side of your screen. Click on the orange arrow to show the control panel. In the question section, you can type any questions you have for me or for the presenters. Please note we will not be responding to the hand-raising function in the control panel. We will answer as many of the questions as possible during the question and answers period at the end of the presentation. We'll post a recording of the presentation after the webinar on the Oley website. Please note that we have muted all of the participants, so you don't need to worry if there is background noise where you are taking this webinar. If you are having technical issues, please go to the Citrix website at the address on your screen. Now for the presentation. While HPN is a life-sustaining therapy for patients with severe gastrointestinal disorders, it brings with it a host of potential complications. Because home parenteral nutrition, HPN, patients are living at home, management of acute complications is initiated by the patient and their caregiver. This webinar will discuss symptoms and signs, causes, immediate actions to be taken, prevention, and specific important points of the major complications that occur with HPN. It gives me great pleasure to introduce today's presenter, Dr. Darlene Kelly and Dr. Michalek. Dr. Kelly was the medical director of Mayo Clinic Rochester's HPN program for 22 years. She served on the Oley Board of Trustees for over 10 years and now serves as Oley's Science and Medicine Advisor. She is also active with the European Society for Nutrition and Metabolism, ESPN, and worked with their Home Artificial Nutrition, HAN, work group for 14 years until this summer. Dr. Kelly has been a valuable contributor at Oley meetings for over 16 years. Dr. Michalek specializes in clinical nutrition at Oley Medical Center. She completed her fellowship with Oley's co-founder, Dr. Lynn Howard, and assumed responsibility for many of Dr. Howard's patients when Dr. Howard retired in 2007. We are thankful to have both of you presenting today. Dr. Kelly, I will turn over the presentation to you to start.
All right. Good afternoon, Andrea, and all of you at home. First, just a little background. If you are relatively new to home parenteral nutrition, or even if you aren't new but you've had your central venous catheter replaced at some point, I wanted to give just a little information that you should be aware of. Often central venous catheter, or CVC or CVAD, is abbreviated by central line, and we will be using that for this session. You should be given a card when your line has been placed that will list the manufacturer, the type of line that it is, the size, and often it will say French. That doesn't mean it comes from France, but that the diameter is measured in this French type of measurement. You should keep this in your wallet because it may be very helpful if you were to change providers or if you need a repair of the line. Record where the marks on the line indicate that that's the location where it enters your body. And if it is moved in or out more than 1 inch, you should call your clinician who works with your parenteral nutrition. There's a Save My Line poster in the Oley website that you can display in your hospital room, and on the next slide we'll see the appearance of that. And I know this is too small probably unless you have a really big screen to read, but you can always get these from the Oley website, and you should print a few of them just to present to caregivers. Next slide. Some things about your home environment that may be helpful in avoiding HPN problems. Don't use the bathroom to set up your infusion. That is asking for some infections unless your bathroom is just crystal clean. Do not set up supplies ahead of time prior to the time that you will connect. You should limit observers who can sometimes distract you and accidentally end up in a contamination. And also restrict pets at the time of connection and disconnection of the HPN and during your central line cares. Kitties really like these lines because there's something to play with. Next slide. How important is cleanliness? Well, clean environments definitely protect you against infections, and you should keep this in mind with your cleaning and even cleaning people who help you. Next slide.
So I'm good. This is Dr. Michalek, and I'm going to review probably one of the most potentially serious complications that can happen with a central catheter. And this is the thing that we work the hardest to try and prevent, because it can potentially be a life-threatening complication if you get an infection of your catheter. So the first things we're going to talk about are what are the symptoms that you should be keeping an eye out for, which might be a sign that your catheter is infected. And first of all is fever. And a fever in someone on HPN may not necessarily be the same as a fever that might be defined by the doctor that you see in the emergency room. So if your baseline temperature tends to run low, an increase of 1 degree or more above your usual baseline may be a fever for you, but it may not necessarily be recognized as a fever by the doctor that you see in the emergency room. So the first thing to do is, if you're feeling badly, to take your temperature, and if the temperature is a little bit higher than your baseline, that may be a sign that you have an infection. Now, an infection may not necessarily be the central line infection, but if you have a fever, your provider wants to know right away. We would rather you call us with a fever and let it just be a cold or something than to not call us with a fever and just say, oh, I think I just have a cold, and then we miss a early recognition of an infection. So other things that may also be signs that you have an infection in your line would be shaking chills, especially if these occur while you're infusing, so you may not be able to stop shaking. Sometimes you can shake so hard that the bed might shake. You may have sweating. You may feel lethargic or achy or have a headache. And all of those signs may be a sign that you have an infection on the inside of the catheter. Now, you can also get an infection at the catheter site, and that may be manifested by redness or pain or swelling where the line comes out of your body. And those may not necessarily be as serious as an infection on the inside of the catheter, but we also need to manage those. And then you can also get an infection along the catheter tract under your skin. So you may be able to feel where the catheter goes underneath your skin. If that's tender along that may also be a sign that you have an infection in the tract, not necessarily in the catheter, but that also has to be addressed. Next slide, Andrea. There's supposed to be pictures on here. Are you seeing pictures?
They are on there, but it has to be a return.
Oh, so hit the next slide, sorry. Okay, there. So thank you, Darlene.
Yeah.
So this is a picture of a central catheter entrance. And so we're kind of looking at this sort of say, is this infected or is this not infected? Well, it's hard to say exactly yes or no on these, because if the catheter is infected on the inside, you may not have any signs whatsoever on your skin. Other things that can cause this redness to occur on your skin may be a reaction to a cleansing agent that you're using or the dressing that you're using, and it may not necessarily be a sign of an infection. So just to be aware that if there's redness, we want to know, but it may not necessarily be an infection, but we should be aware of it. Next slide, Andrea. There's going to be another picture here. So this is a site of a port that you can clearly see is pretty swollen and looks inflamed. And this would be consistent with like a pocket infection of a port or a localized site infection. If you have a Hickman catheter, you have swelling and more redness. And again, this is something that we want to know. You may have a fever with this or you may not. Next slide. And then this is a catheter. We show this to show you that, and we don't use iodine so much more in dressings, but iodine can stain the skin and can sometimes look like there's some redness there. And again, if you're having a fever, even if your site doesn't look red, this inside of the catheter may have bacteria in it and your site may look just fine. So again, if it's a inside of the catheter that's infected, you may not see anything, but if you have a fever or any of those symptoms, lethargy, feeling achy, any of those things, make sure you let your providers know. Next slide. Oh, you can go ahead onto the next one, Andrea. Okay, so the causes of infection, there are some things that we can control to try to minimize the incidence of infection. And the number one thing is proper hand washing. Make sure you use good aseptic technique during connection and disconnection, because if you have poor technique, that can increase your risk of infection. Other things that are less likely to cause infection of the catheter are potentially contamination of the tubing or the flushes. And again, this can happen during handling, so your aseptic technique is very, very important. You should never reuse supplies because that can certainly increase the risk of infection. And if you're exposed to other illnesses, people with other illnesses or your pets, sometimes in the site when you're doing your dressings or accessing your line, that can lead to contamination. There is a potential risk of contamination if you have a fistula or you have a stoma or you have drains. And it's really important to try and keep the end of your catheter away from any of these sites to prevent exposure of the end of the catheter to these areas. Poor dental health. You can get a bloodstream bacteria when you're doing dental care if you have poor dental health, and there is some slight risk, I think, of potentially contaminating the catheter from within, although I think generally we think that this risk is relatively low. If you have retained sutures in the skin, sometimes that can lead to an infection at the site. Again, not necessarily inside the catheter, but that can potentially lead to a site infection. So we need to kind of look at those sutures if you think they're getting red. And I think a pretty rare occurrence is that sometimes the HPN solution itself can be contaminated. I personally have not seen this to be the case, but it certainly is a possibility that during the preparation of your solution, so that it could have potentially been contaminated. So if you're seeing repeat fevers during your infusions, we can evaluate the solutions themselves and culture them to make sure that there's not an infection there. But again, I think this is pretty rare. Next slide. So what do you do if you have if you think you may have an infection? So if you have any of those signs, fevers, shaking chills, feeling weak, tired, just not yourself, don't hesitate. Make sure you call your team right away. If you can't reach somebody on your team, go to the emergency department, tell them that you have a central catheter, that you're concerned that it might be infected. I think the sooner that you react, the less likely that you are to have a serious consequence, and they can be life-threatening if there's any delay. So immediate action is really just call your team or go to the emergency room if you can't reach somebody on your team. Next slide. So how do we prevent infection? So the most important thing is, again, meticulous hand washing. Using gloves doesn't necessarily replace the need to be very meticulous about keeping sterile during your handling of the catheter and accessing the catheter. So you want to wash vigorously for at least 1 minute. So you want to time it. You want to have a way that you know that you're washing your hands for at least a minute. And we know that this is the most effective way to prevent infections. Hand sanitizer is not appropriate, especially if you use, if you handled a wound or drainage or ostomy. The best thing is vigorous hand washing with soap and water. And then always, this has to be a routine every time you handle your line, because you are the most important person that's going to protect your line. And you're the one that handles it the most. Next slide. A few more steps. This is another point that in terms of just having a fistula or an ostomy or drain tubes, you want to prevent the line from coming in contact with these. So you don't want the line to be sort of hanging down inside your clothing where it can rub against other openings that you might have there. You want to try and coil it up, keep it up near where the opening is. If you can tuck it into an item of clothing or something that's up above, that can keep it from being near your other drains or ostomy. Take a look at your solution before you hang it up. Make sure there aren't any particles in it, that it looks nice and clear. And if there's any concern, make sure you contact your vendor or your clinician. Try to avoid close contact with people you know have illnesses, especially if it's like an infectious disease. And then just make sure you're getting routine dental checkups to make sure that you don't have any dental infections. Am I turning this over to you now, Darlene?
Yes, next slide.
Okay.
Okay. Some of the important points, many of which Anne has already discussed. Call your HPN team or provider if you have a fever or exit site changes. Do not wait. Central lines don't always have to be removed just because of an infection. And infection management is something that should be discussed with your team before a central line is removed. And I can tell you that this is one discussion I've had with people at 3 in the morning in an ER as they're just about ready to pull that line. So that's just one thing you should be aware of, because you do not have innumerable locations that you can place those lines. Remember that the TPN solution, the HPN solution, must be refrigerated. If a bag comes up to room temperature and you suddenly decide you don't want to use it, then don't put it back in the refrigerator, because that can be an issue. And the other thing is, multiple lumen catheters are associated with increased risk of infection. Single lumen catheters are preferable unless there's a very good reason for that multiple lumen. Next slide. Next slide. Now, when you present to the ER, the cultures that need to be drawn are 2, and they must be drawn before they have given you any antibiotics, because that can falsely make your cultures negative. One should be done peripherally from an arm vein, and one must be done from the central line. And there's a tendency of some labs to discard the first draw from your central line. Don't let them do that, because that may make the culture negative when there is actually contamination there. The cultures may require 1 or 2 days to grow, and if it's a fungal infection, it can take up to 5 days for these to grow. We typically would start antibiotics after the culture is drawn, but empiric antibiotics that are fairly broad spectrum. But the results should be known before deciding to remove a central line, unless your blood pressure and pulse are out of control and you're in the ICU. Some infections may actually always require removal of the central line. These include fungal and some other bacterial infections. Next slide. Anne, I guess this is you. Anne? Oh.
We're good. We were muted, sorry.
Oh, okay.
We've gone over infections, and I think it's important to know that that's probably the biggest concern, and that's the thing that you need to be most aware of. We're going to run through some other potential complications of being on home parenteral nutrition, but I think these are less common and potentially less serious, although hypoglycemia certainly can be serious if your blood sugar falls significantly low. So when you're on home parenteral nutrition, the carbohydrate component of your nutritional formula is dextrose, which is sugar. And it can be infusing at a fairly rapid rate to try and get your infusion done during the night so that you're not connected all during the day. And so that the sugar tends to run relatively quickly. So if for some reason that infusion gets interrupted, your glucose level can fall somewhat quickly. And so these are the symptoms that you might experience if you had a low blood sugar. And there's quite a lot of them, and you may not necessarily have all of those, but irritability, being disoriented or confused, you may have some blurred vision or slurred speech, feeling weak or unsteady. You may feel shaky, tremulous, you may be sweaty, pale, you may have some nausea or headache. You may experience some heart palpitations, or you may feel some numbness around your mouth, or just feel hungry. And all of these things can be signs that your sugar might be on the low side. Next slide. So what would potentially cause that? If you have a malfunction of your pump and the pump stops before you get to the end where it's going to taper you down slowly and gradually decrease the glucose infusion. If you have a sudden stop in your infusion, then the sugar may fall quickly. If the pump isn't running at the proper rate and your bag finishes before it can taper down slowly, or if your bag volume isn't the same as the volume that you programmed into the pump, then it's going to finish early and it won't have time to wean down. So again, that can lead to a sudden drop in your sugar. So if the pump gets reprogrammed inappropriately, or the rate isn't on the proper rate, that can lead to the solution ending before it's supposed to. Now, some folks are needing to add insulin into their TPN bag to prevent their sugars getting high during the infusion. So if the amount of insulin is not appropriate and you get more insulin than you need, then that's going to cause your sugar to drop actually during the infusion, not because the infusion stopped, but because you're getting too much insulin relative to the amount of sugar that you're getting. And that can cause your sugar to go low. Next slide. So what do you do? All right, if you have insulin in your bag and your sugar is going too low, you need to stop the infusion immediately, because you're just going to keep pumping more insulin in and it's going to make your sugar go lower. Of course, you want to check your blood glucose level if you have a glucometer at home. And if your glucose level is below 70, you want to start trying to get some sugar into you through your oral route. So either fruit juice with a couple teaspoons of sugar, or if you have available, if you've had this happen to you before, you may have available some glucose tablets, or you can use cake frosting or decorating gel, which is all sugar. Squeeze that into your mouth under your tongue. You'll absorb that quickly. You won't even have to swallow it. And then you want it, or you can just use a couple teaspoons of sugar. If you don't have any of that, put that in a little bit of water and drink that. After you do that, you want to wait a few minutes and check your sugar again and make sure that it's coming up. If you're not seeing any improvement, you'll want to call 911 right away, because they can get someone there who can give you an injection, intravenous glucose, and that will bring your sugar up immediately. Next slide. So how do we prevent that? Okay, so number one is make sure that your bag volume and the pump volume are correct, so that your pump knows the right volume to infuse, so the bag doesn't run out before you're at the end of the infusion. Try to avoid stopping early unless there's some emergency that you need to come off. If you stop it rapidly, your sugar may fall. And if you do have to, for some other reason, if there's something going on with your line that you need to stop the infusion, just be aware that you might want to take a little bit of sugar by mouth as you're coming off, to prevent your sugar from dropping low. And then if you are adding insulin into your bag as part of your routine management and to maintain your sugar during your infusion, make sure that you double check that you use the right insulin type, the right prescribed amount of insulin, and actually double check that you're using the right syringe size, because there has been instances where people drop too much insulin because they're using a syringe that's too big. So that you want to make sure you have the right amount of insulin, because too much insulin will drop your sugar during your infusion. Next slide. So important points. Check and make and record your blood glucose levels at home. If you've been sent home with a glucometer with instructions to keep an eye on that. Hypoglycemia can occur during infusion, like I said, with insulin, but more often it occurs if the infusion is stopped quickly, and it will happen within 15 to 30 minutes. So what we always order for our patients is that we taper, ramping down the HPN infusion over about an hour before we disconnect. And the pumps are programmed to do that, to automatically taper, which is why it's so important that your pump knows the correct volume to infuse, because it's programmed to taper it. If you have any problems or discrepancies in your glucose and you're concerned, make sure you contact your team and let your providers know that there may be a problem with your sugars. And then just be totally consistent with the amount of insulin that you're supposed to be using, the time of your infusion, that your pump is set consistently to the proper orders according to your team. Next slide. So the opposite can also happen. Hyperglycemia means high blood sugar. And again, this can happen because we are infusing glucose at a pretty high rate. Now, in most situations, your doctors are going to make sure that your sugars are not running high during your infusions before they send you home with the infusion. But sometimes things change. If you get sick at home, or you have an infection, or you have some other problem going on, you may not handle glucose as well as you were initially, so that there's potential that your sugar could go up during your infusion. So the things to recognize for a high sugar, immediate things may be poor concentration, blurred vision. You may start feeling tired or drowsy. Again, you may have nausea, and again, you'll recognize some of these symptoms may be similar to those of low sugar. You may feel restless. If your sugar is high, you may find that you need to urinate more frequently. And if this goes on for a while, under delayed responses, you may find that you're getting more thirsty just because you're urinating and losing more fluid. If you have hyperglycemia or high blood sugar consistently for a long period of time, it can increase your risk of getting an infection, and it can also affect your ability to heal wounds. So it's important that we try and prevent you being hyperglycemic, and that's why some people need to add insulin into their HPN solution. Next slide, please. So the causes are your HPN may be infusing faster than your body can handle the glucose, so the rate may need to be adjusted. You may not have enough insulin added into the infusion solution, so that may be something that needs to be adjusted. And again, all of these things need to be discussed with your team so that we can troubleshoot and get you on a infusion that's going to prevent you from being hyperglycemic. Some things that can happen if you put the insulin, if you are adding insulin into your bag and you're not mixing it properly, you may not be getting the insulin in the beginning of the infusion if the insulin isn't infusing consistently along with the sugar. So make sure you're mixing the insulin gently but thoroughly after you inject. And also, if you're started on certain medications by maybe another provider for some other health reason, there are potential effects on raising your sugar, particularly if you're on steroids. If you get an injection into your joint, for instance, say you have arthritis and somebody gives you a cortisone injection, that may affect your ability to handle glucose during your infusion. And then certain chemotherapy agents can do that, and there are certainly herbal supplements, some over-the-counter products. So it's really important that you discuss with your HPN team any other medications, herbal supplements, over-the-counter products that you might be considering using, so that they can give you advice as to whether this might have an effect on your sugar. Next slide. So immediate action if you have a high sugar is to call your team and let them know right away, because they may want you to taper your infusion down slowly, but I wouldn't recommend that you turn off or stop your pump immediately unless your team tells you to. So you want to make sure you let them know as soon as possible that your sugars are running high, and ask them their advice in terms of what they would recommend that you do right then. I wouldn't recommend that you just kind of try and handle this on your own if your sugars are running high. Next slide. So in order to prevent the high blood sugar, we're going to make sure that the infusion rate is appropriate so that the volume and the pump are set properly. If the insulin is being added to the bag, make sure that you mix it well, rocking or rotating the bag, make sure it's adequately mixed. And then always use a pump. Never run your solution without a pump, because you need to make sure that that infusion rate is very consistent. Next slide. So important points. Just something to note is that if you do get a high glucose and there hasn't been any change in your formula, nothing is going on with your infusion, hyperglycemia might be a sign that there is an infection. even before you get a fever. So again, notifying your team, they may have a little heads up before you're even aware that you have an infection that we can check to see if you do have an infection. And then always make sure that you use an insulin syringe. If you're adding insulin to the bag, make sure that you're using the proper syringe so you avoid getting too much insulin. Next slide. And I'm going to go back to Darlene now.
There are numerous signs and symptoms of dehydration, and this can occur even when you are on parenteral nutrition for a number of reasons. We'll talk about those in a minute. But if you notice a dry mouth and eyes, that can be an indicator. If there's increased thirst, there could be dizziness and lightheadedness, especially if you're getting up from a lying down position and you stand up quickly. This will be one thing that is a quick thing to notice. And with that, the heart rate may increase if things are working correctly. Muscle cramping can also be an issue. Weakness, fatigue, dark urine, decreased urine output, low-grade fever, unexplained rapid weight loss. Next slide. And some of the causes for these, of course, depletion of body fluids and electrolytes because of increased losses that can occur with vomiting, diarrhea, sweating, high fistula outputs, high ostomy outputs, wound drainage, use of diuretics and water pills. That's one thing that often happens because people notice some swelling in their legs, and it might even be a prescribed medication, which is maybe inappropriate in someone who is close to dehydration. Laxatives also will be an issue. HPN and intravenous fluids that are infused too fast, and inadequate HPN volume. Next slide. The immediate thing, do not turn off or stop your HPN suddenly. Call the HPN team immediately to relate these symptoms and signs. Describe any changes in your fluid intake or output. And to that, I might also add, if you're taking in a lot of sugary things or very high salty things, that can cause your urine output to increase and make you have dehydration. And the first thing that you should do is start measuring your 24-hour urine output. That is really a good indicator of what's going on. Sometimes physicians suggest measuring ostomy output as well. Next slide. The one big prevention thing is infuse all of the volume of the HPN and be consistent with the number of days per week as ordered by your HPN team. As I said, an input-output log can be very helpful with your and can explain what's going on to your HPN team as they analyze these logs. Follow orders and guidelines that were provided during training or discharge from the hospital, and monitor your weight at least 3 times a week, but be certain you monitor it at the same time every day. For instance, if you monitor it right after you've taken your TPN, you're going to be perhaps better hydrated at that point. But then the next day, if you monitor it right before starting your TPN, you'll think, oh my gosh, I've lost a lot of weight. And that's because of the fluid losses that you have through the day. Next slide. Important points to think about. The earliest, simplest, and cheapest way to be aware of dehydration is by monitoring the urine output. The kidneys know to try to crank down their fluid output when you start to get dehydrated, and that's an important indicator. The goal for a urine output in people who've not had kidney stones, etc., is greater than 1 liter a day. And if your urine output is significantly below that, your team needs to be aware of it. Body weight is also an indicator. And yes, they can tell by laboratory tests if you are dehydrated, but these things all come later than the first ones on this list. Next slide. Anne?
Okay, so this is just a quick note. You sometimes may see blood in your central line. You may see it in the tubing. If it's left in there, it can lead to an occlusion or a clot. The causes would be not flushing immediately after the infusion. The cap may not be correctly attached so that there's a small leakage and the catheter is backflowing. If there's a crack in your hub or a tear in the line, all of those things can lead to blood tracking back up into the line. Next slide. So if you see blood coming into your line, you should clamp it, use your little pinch clamp and clamp it so it doesn't keep coming out. Check it and make sure that there isn't any, make sure your cap is on tight, that your connector is secure. You want to clean the central line hub, replace it with a new cap and a new connector. Make sure there aren't any cracks. If there's cracks, leave it clamped and then make sure you call somebody right away or go to the emergency room. And then if it's just that the cap wasn't secure, you can put a new one on, unclamp the line, and then flush it with your saline or heparin, whichever solution that you use. Next slide. So to prevent it, obviously you're going to flush immediately after your infusion. You want to use a brisk, sort of push and then pause, sort of like a plunger. And then make sure that your cap is secure and that the connector's properly on, and clamp your central line properly to make sure that the blood doesn't back up into the line. Next slide. So if you do get a central line occlusion or a clot, you may notice that it's difficult to flush it. There's more resistance, or you may not be able to flush it at all. You won't be able to infuse. The nurses won't be able to get blood from the central line to draw your blood. The causes of this are either blood in the lumen, so if you had blood back up, or some precipitate from your infusion, although this is really rare. Not flushing properly or not clamping properly after your flush can also cause the line to fill with blood and then get a clot. Next slide, please. So if you have an occluded line, you need to notify your team right away. Make sure your cap and connector is attached. If you were infusing and the infusion was stopped because it became clogged during the infusion, you need to make sure you follow the instruction we talked about for hypoglycemia because you're at risk. But the most important thing is to notify your team, and there are some techniques that they can use to possibly get the clot dissolved. Next slide. So to prevent it, you want to make sure you use the proper filters with your IV tubing during the infusion. Make sure you're flushing your line well before and after your infusion. Maintain the infusion rate at the prescribed rate. And make sure you check every day. Look at your hub, look at the line, make sure it's not getting weak, there's no tears, it doesn't look like it's breaking down or cracking. All of these things can lead to the blood sort of leaking back into the catheter and then clotting. Next slide. So important points. If you do get a clot, your team may prescribe a medication that will dissolve the clot. Your central line doesn't necessarily have to be removed or replaced if we can get it open. We prefer to try and save lines and use and replace them as little as possible. And then we're going to try and use all of our strategies that we have to open that line before we're going to before we're going to go to removing it and replacing it. Next line. Next slide, please. Things to just be aware of in terms of your line itself. They can be fragile. You can get tears, you can get cracks. Signs of a tear would be leaking from the line, so you kind of feel dampness. You may even notice that the tubing is broken or damaged. This can be caused by, having scissors or clamps, or hopefully not, animals around that can damage your line. If you use excessive pressure when you're flushing your line, especially with a tiny syringe, that creates a lot of pressure, and that may damage the line, causing a ballooning and a tear. Try to avoid twisting the tubing or clamping it really tightly during connecting or disconnecting, so that you don't damage it. And then just simply, if you have a long-term catheter, some people use the same catheter for years and years, and we sometimes see just wear and tear from an aging catheter. Next slide. So what you want to do if you do see a tear in the line, you stop the infusion. You're going to clamp your line so that you're going to clamp the line between the tear and your body so that nothing comes back into you from that tear. And you call your team right away or go right to the emergency room, because that line needs to be repaired immediately. Next slide. So how to prevent it. Be very careful when you handle your line. Don't use any pins or tape or anything on your line. Make sure you clamp the line where it's strongest, near the reinforcement by the hub. And move the clamp from place to place so it's not always in the same position on your line. Don't use excessive pressure or twisting or tightening during connection. And don't use excessive force when you're flushing. And make sure there aren't any sharp objects or animals around when you're handling your line. And then make sure you just check your line for cracks and making sure it looks intact. Next slide. So important points are that central lines, when they're cracked, can often be repaired. They don't necessarily need to be replaced, and we would prefer to repair one before replacing it again to save access sites. So there are repair kits that can be used to repair catheters. Most of the places that put in catheters are aware of these repair kits, and they can do repairs. So if the tear is pretty far away from your chest, it's pretty easy to repair the catheter. So don't just jump to replacing it, but try and see if you can get it repaired. Next slide. So same is true of a cracked hub. Again, you're going to see leakage of fluid. You may even see the crack. The causes are similar: over tightening of the cap or connector, or wear and tear on an older catheter. Next slide. And again, you're going to handle it the same way. You're going to clamp it between the crack and your body, disconnect from your infusion, and call your team right away. Next slide. So to prevent it, don't use too much force when you're attaching things, or and keep an eye on your older catheter, just looking for wear and tear. If you notice there's a thin site, a spot, never use acetone around your line. That will cause damage to the line. It thins out the polyurethane. It makes it weaker. And if you're seeing a lot of cracking frequently, we just want to make sure that we assess if there's a problem with the line itself. Maybe there was a bad production lot or something like that. So make sure we notify the team and the vendor. Next slide. So important points like I said before, we don't always have to remove the catheter if you have a broken hub. It's better to try and see if we can repair it. So make sure that you notify your team, but talk to the people that put your line in and see if they have a repair kit, and try and attempt to repair it before the line is removed. Next slide. Back to Darlene.
Is air embolism, and these are rare, but they can be another really serious thing. The symptoms include shortness of breath, coughing, chest pain, loss of consciousness, and it happens because a large amount of air has entered the line, and I mean a large amount. Just the little bubbles that you sometimes have in your line will not cause this. If the IV tubing gets disconnected, if there's leaking around the injection cap or connector, if you have not primed your tubing before you connect to your TPN, and that could be enough air to put you into this problem. Central line tear, air in the line below the filter. Next slide. You need to clamp that catheter immediately. It is a medical emergency. Call 911. Don't wait. Lie on your left side with the chin tucked toward your chest, and the head should be down lower than your feet until the emergency medical service arrives. Next slide. To prevent this, always use the lure lock connection on all tubing and secure it well. Be sure to prime the tubing. Tighten all connections, but do not over tighten. Use adequate length of tubing to prevent disconnection, and secure connections with either a central venous catheter holder or your clothing. Next slide. So in summary, we've covered and some of the potentially serious complications that can occur with home parenteral nutrition. We've done infections, blood sugar abnormalities, dehydration, blood in the catheter, central line issues, including occlusion, damage.
Darlene, we can't hear you. Can you try moving something? You keep touching your microphone.
Okay, sorry. Is that better?
Yep.
That's much better.
Yep.
Sorry to interrupt.
So I'm assuming you've read this slide, so I won't repeat it. But these slides will be available in the Oley website soon. So that's it. Thank you.
Great. Now we can begin the questions and answer sessions. If you haven't done so already, please feel free to submit your questions in the questions section of the toolbar on the right side of our screen. We'll do our best to answer as many questions as we can, and we'll take a few right now. We'll start with, what is the percentage of patients with central lines that at some point develop infections?
100. No, I mean, it's kind of, I'm being tongue in cheek, but there is a finite incidence of infection when you have a central catheter. And I personally do not know of any person on HPN with a long-term indwelling catheter that has not experienced at least one infection. Now there's a wide variety of a frequency. Like some people may be infected every 6 months, and some people may be infected every 10 years. But inevitably, there is probably going to be an infection at some point in the catheter. And there isn't really any way to predict this, but we know that the better the technique and the more meticulous that you are with handling your line, and also protecting your line when you're in the hospital. Don't be afraid to speak up if you see somebody that's not doing proper technique on your central line. It's your life. So you don't be afraid to tell nurses, look, you're not doing that right. And just, be very protective of your line. But it probably will at some point get infected no matter how good you are. And that's just something that we have to live with when we're dealing with a central catheter, unfortunately.
I will back up what Dr. Michalek has just said. We had one patient go 14 years before the first infection, and that was out of about 1,200 patients over the years I worked at Mayo.
Great.
So it's pretty close to 100%.
We have another question coming in. What can patients/caregivers do to plan ahead before they get into a situation where a doctor who is unfamiliar with TPN or unfamiliar with the patient's case makes a decision to pull the line prematurely?
Well, if your HPN team knows about it or anything, I would suggest that doctor call your physician, please, before removing the line.
Yeah, it's your line, so they can't take it out unless you give them permission. I mean, obviously, if you are in extremis and you're hypotensive and they're thinking you're septic and you're going to the ICU, that line's got to come out right away. But if you're feeling well and you just had a fever and you're concerned about the line being infected and you're not critically ill, it can wait to come out. You may not want to put anything through it, but you can leave the catheter in place until you have a little bit more time to, discuss it, maybe get your own team involved, have them to contact the doctor that you're working with if you're not in your home environment.
And one thing you said that we did not talk about was putting anything through the line other than antibiotics if it looks like the line is infected. And
Right.
And we will often have, if you're admitted to the hospital, which you probably would be in that situation, we often have them give fluids and electrolytes peripherally, but not parenteral nutrition, until you've had at least a few days of antibiotic treatment.
Okay, we have another question coming in. If a small tear is in the line, how fast would I know? I have a double lumen Hickman.
I think you would know pretty quickly because you're going to feel that, leaking onto your clothing during the infusion. You're going to feel that there's some moisture there. You may also see some blood, backing up into your catheter when you're not using it, which would imply that, there's something leaking through out of the catheter. So usually people are aware of this pretty quickly. It's unusual that you wouldn't know it was there.
And if that moisture is on your clothing and it has had vitamins in that TPN bag, you'll probably have a yellow stain too.
True.
Mm-hmm. Okay, when would you recommend an ethanol lock or a vancomycin lock? Someone with frequent line infections?
Darlene, you want to take it or me?
Yeah. When I was still working, we did not use many ethanol locks. That kind of came out after I retired in sort of aggressively. But I can remember a patient who had a total hip done, whose total hip got infected with at the same time as his blood was infected, and that's the type of person that I would immediately consider an antibiotic lock. But I looked at all of his prior infections to really figure out what the lock should be from. The ethanol lock, of course, is effective in both frequent bloodstream infections from, it even helps with the fungal infections, but bacterial infections, if you have the right antibiotic in your lock. Oh, and sorry, I switched things. It's useful with the alcohol lock, the ethanol lock.
So an important point is that generally, let me just say that I generally don't routinely use either an antibiotic or an ethanol lock unless I have a patient who is becoming infected frequently.
Yeah.
If you use an ethanol catheter lock, you need to have a silicone catheter. And the typical catheters that we use are polyurethane. So it needs to have a special catheter placed in order to use the ethanol lock, because the ethanol will actually denature the polyurethane, which is the catheters that we typically use. Polyurethane catheters may be a little bit sturdier. So unless we need to switch to a silicone catheter because of frequent infections, we generally stay with a polyurethane catheter and don't use an ethanol lock. Now, there are some issues with getting ethanol locks approved. I don't know if you're aware, but Medicare and Medicaid won't cover an ethanol lock. So that kind of is a moot point in those folks who have Medicare or Medicaid as their insurance. But it certainly, there is very good evidence that using an ethanol catheter lock can reduce the incidence of catheter infections in patients who have frequent infections. So I personally use them, but only in my patients who are being infected frequently. In patients on Medicare and Medicaid, we will use an antibiotic lock in those folks who are becoming frequently infected. The downside there is that you can develop resistance to the antibiotic that you're using, so you may get infected with a resistant bacteria. And any antibiotic is not going to necessarily cover every possible infection, so it's not as universal as using ethanol, which Dr. Kelly was just saying you can use for both bacteria and for fungal infections because it basically disinfects the catheter. When you choose an antibiotic, you're not going to be covering for fungus, and you may not be covering for every possible bacteria as well, because the antibiotics are specific for certain bacteria.
One thing that may be encouraging is that there are reports of, especially out of the Netherlands, of another lock that may be much more effective. It's not FDA approved at this point, but just keep your eyes open for information that these may be a better answer.
It sure would be, if we can get the FDA to come around.
Is it Taurolidine?
Twirling.
Yeah, there are a couple of different types of it, and so one is better than the other. I think we still have to be looking at what's happening at FDA.
Great. I think we've run out of time, so we can post the answers to the rest of the questions on the Oley website. Listed here is the HPN homepage on the Oley website, where you can find numerous resources for minimizing HPN complications, including our webinars, HPN Awareness Week, which is this week, Save My Lyme poster, and the HPN complication chart, which should be coming out soon. Thank you, Dr. Kelly and Dr. Michalek, for an excellent presentation. We appreciate you sharing your expertise with us. Many thanks to Quorum CVS Specialty Infusion Services for supporting this important educational program. Thank you also to participants for joining us. We'll post a recording of the presentation on the Oley website in case you'd like to view it again. We hope you will join us for another webinar. To view our schedule of upcoming webinars and past recordings, visit the Oley website at oley.org/webinars. And that's it for today. Thanks and have a great day.